It's so easy to place people in boxes. There are patients with long-term conditions, there are some nearing the end of their life, and then there are maternity patients. There is us, and then there is them. There are those of us with many chapters of conditions and challenges, and there are those of us that are just starting our own stories. There are those of us that do not understand, and those that can't understand. There are those of us we share a lot with, and those we need to share more with. And then there is us, the workforce, the nurses, the midwives, the pharmacists, the doctors, the admin team, all healthcare professionals, social care, voluntary services, the hospitals, the clinics, the GP practices, ambulance crews, porters, and many, many more. We are the ones that can ask you, what matters to you? And not just focus on what's a matter with you.
We were able to put together a care plan with no time restraints, so being able to see the woman at home meant that I didn't have the limitations of a clinic appointment. It was the woman's second baby. Her first birth was quite traumatic, so we worked a lot around that antenatally and putting together a really personalised care plan to ensure that she felt in control and didn't feel like things were taken from her this time. So after she achieved a normal vaginal birth with no intervention, she felt really accomplished and was really pleased that she had all of those steps in place, and as a midwife to be able to see how pleased she was and how much it meant to her was just invaluable.
So personalised care in Derbyshire has allowed us to develop my role in particular and take the support planning from hospital to home and make sure that families get the best service that they require. I think it's really imperative that parents that know they're going to have a preterm birth for whatever reason are given the opportunity to discuss their feeding preferences before they give birth. This will allow them to kind of make the decisions that are right for them and their family. So as a result of collaborative working within maternity and neonatal services, when I'm informed that there is a premature baby that's either due to be delivered or has just been delivered, I approach the family to have a conversation with them. This allows them to kind of continue making their choices.
I think the most important thing about supporting a surrogate and the commissioned parents around their legal choices is about doing an individualised care plan. In order to do that means talking about what their expectations and wishes are around pregnancy, around labour and birth, and then obviously in the early days after having the baby. It involves us making contact quite early in pregnancy, around 16 weeks, and then arranging maybe another 2-3 meetings with the surrogate and commissioning parents to see how the pregnancy is going, but also talk about different aspects around their labour, birth and postnatal period, and bring all that information together so that as time passes, by the end of pregnancy, we've got a very detailed care plan which is put into the surrogate's hospital records, and the surrogate and the commissioned parents also get a copy of that detailed care plan. So it's all really clear at the point that surrogate is coming in labour what the plan of care is, so that there isn't any confusion.
Shared care is just all about communication. Whether that's happening in meetings, or you're picking up the phone, or you're having to go on a Teams call, or you're just documenting really clearly. I've been working in speech and language therapy for about 20 years now, and basically a good year of that time this patient has been in my professional career. She was just a few months off her 50th birthday. At this point when I first met her, she wasn't able to eat and drink at all, and we started to make some progress where it became apparent that cake was going to be on the menu for her birthday, and that was really, really important. So it was a daily process of really trying to get to the point of making sure there was enough movement in her tongue, enough strength in her throat to be able to swallow safely, to be able to keep her from having another chest infection, from having to go to an acute ward or to intensive care again, and actually be able to swallow safely and to enjoy the taste of the food, and then all that was going to celebrate. So to be able to have that special cake, and yeah, we had to mash it down a bit, we had to add a bit of extra cream and make it a little bit softer, but she loved it, and that was really important. We actually need to give as much power to the patient as possible, and that isn't just going to be about what medications you want to be on, or what time you're going to eat, but just finding out when are your family coming in today, because we want to really prioritise that opportunity to see them and connect with them and build our therapy around that. What makes you tick? What's important for you?
So here in Derbyshire we have the hub where I work alongside a physiotherapist, and we bring these services to the community for people who are struggling to access the services at the hospital settings. By offering a social prescribing and coaching technique, I'm able to take time to listen to the patient and find out what's really important to them and what the barriers are for them accessing the healthcare and services that they need. So without this social prescribing service, these patients will struggle to access services. It's likely that they might struggle to navigate some of the services and potentially drop out and not receive the healthcare that they need. Personalised care approaches work well with the technique called the GROW model. I can see that it's making a difference to individuals because they feel like they're being heard. They've had the time for somebody to listen to them and hear their story and help understand what's important to them.
So as part of the holistic needs assessment, we identify the patient's needs, so it could be hair loss, so then we refer to the wig service. It makes me feel proud that we can support our patients through the cancer diagnosis and that we make a difference to their lives.
So I arranged to visit Linda and her husband and had a chat through how she felt she was doing, and she realised she was very poorly. And I asked her permission to talk about, well, what would she like at the end of life? What would she like? What wouldn't she like? And asked her what matters to her. And really at the very end of life, when she said, do you know what really matters to me? I want to go to Twycross Zoo with my great-grandson. And at this stage I thought, do you know, she really is serious. This really matters to her. And actually, if it really matters to her, it needs to really matter to me. And I'd heard a podcast by the Christian Ambulance Association, so I went online and found their Facebook site and sent them a message. And they replied, yes, we can link you up with the Ambulance Wish Foundation. They can perhaps sort it for you. And she was absolutely over the moon. And she said, I can't believe you've done it. And I said, I can't either. And when they got there, they went in the ape house, and Linda was lying there on her bed. They'd taken her in, and she put her hand up to the glass, and this monkey came along and put his hand up to Linda's, and apparently the whole family cried. I think the key thing is to ask the patient what matters to you, because if we don't ask them what matters to them, we won't know, and if we don't know, we can't help them achieve it.
We who can make a difference. We who can help you to make choices. We who can offer more than just medication. We who can identify those who have never been asked. We who provide a joined-up care across Derbyshire. We who are a workforce that provides personalised care.